Three words for Wilmot Dixon Interiors and our approach to healthcare would be collaborative, successful, passionate. I think that healthcare is a really important part for the business.
The NHS is a national treasure, as we know.
The benefit of sector leads is really focusing on an expert capability, such as the NHS.
I've been doing healthcare for nearly 17 years now.
Where understanding the language, the governance and the quality and expectations and design they need comes from expert leadership in that field.
I enjoy the clinical engagement. I enjoy seeing the clinicians, understanding the design and working to a collaborative solution.
These are complex working environments where we have to engage with clinicians, nurses, patients. Understanding what they want from that refurbishment or build is super important to a successful project.
We understand their constraints, we understand what they need for an OBC, FBC to get the project through their governance. They know our customers, they know the way we work, they know our design team and our supply chain. Consistency of delivery of the projects for us is fundamental. Hi, my name is James Howard. I'm healthcare lead for Wilmot Dixon Interiors, so that means any healthcare project that comes through us will be led by myself. The key components are collaboration between all of the parties involved, so the design team, the trust, the estates team.
Our health approach has come from our expertise within the organisation and the leadership we have. We know how to design, we know how to procure, we know how to deliver.
We understand the different types of health environments we're working in, whether that's mental health care, medium secure, high secure mental health. They're all nuances.
They are extremely difficult projects working in live hospital environments.
But the ability to understand live environments and keeping them operationally fit at all times is a key skill set that our team have.
The communication and collaboration with healthcare projects is a must.
A number of hospitals aren't fit for purpose, whether that be through the patient pathways or the staff using those hospitals. We're identifying those trusts that have got tired estates, complex estates, and we're able to help customers deliver a variety of projects.
The earlier you get us involved, the better. We come with the wealth of actually delivering these projects. We know what we will need, we know how we can flex with our requirements as well to help with the trust.
What's particularly attractive to health trusts is the routes to market that we can offer.
The procurement routes are vast really. There's P23, Skate, Procurement Hub, Pagabo. There's a number of frameworks that the trust can choose to use.
We've got collaborative frameworks where we can get involved at the outset, appoint those design teams, work with their stakeholders and get that product ready as soon as they can to get patients through those corridors.
The early engagement with ourselves really benefits the project and reduces the cost of the project as well.
It's one of the sectors that really benefits from our Wilmot Dixon group approach, where we've got local construction offices based all around the country with tried and tested partners that we can go to when we get jobs in different geographical areas.
With working with NHS projects, you have to be flexible with your design approach, and by using strong architects and strong MEP designers that understand the regulations.
We have an in-house interior design team that brings with it a huge amount of benefits for what it is we are doing on a day-to-day basis. You get a team who's well established, you get a team who understands the contracts and a contractor who understands them.
We've also got great relationships with anti-ligature and healthcare specialists, which means we can react at great pace when required.
The speed that we can manage change, we're able to show you very quickly the impact of your decisions.
If you don't have a flexible design, the clinical sign-off is going to become difficult, so flexibility is key.
Often the health service is constrained by financial year budgets. That can be really tricky.
Financial constraints, end-of-year spend, programme and logistics. These are common problems for all NHS projects that I've been involved in, and it's about finding solutions as quickly as possible.
So we've got innovative ways to work with our supply chain, to programme works and sequence works so that they can maximise their budgets in that financial year.
I think supply chain partners, including design team and then our subcontractors, are extremely important. If they haven't done healthcare work for us, then they're really going to struggle to become part of my team. They're a niche project to do healthcare projects. You have to understand the regulations, like I say, that we work to. You can only learn that from delivering healthcare projects. The continuity, not just with Wilmot Dixon, but with our subcontractors and our design team, is really important. The quality that Wilmot Dixon offer for their project is market leading.
The quality team will spend time looking at tenders, pre-construction, and spend time with the operational teams when they're out on site, offering guidance and support on quality.
When we're working in live hospital environments, for us to go back into areas once they've been handed over is extremely disruptive to all parties, patients and clinicals. We need to hand over commission as a turnkey project.
The customer service team spend time on site throughout the project to ensure that we offer a consistent service through the defect period.
I believe our quality process, early engagement on commissioning allows us to finish 100% on the day of handover so that we aren't there back in dealing with issues because everything's been resolved.
Over 25 years of experience, countless acute hospital trusts upgraded, solid relationships with clinicians, estates directors.
Our offering is strengthened by the fact that we have got the experience and we can demonstrate it.
Our service lead brings vast experience, not just with Wilmot Dixon, gained across the industry, which is to the benefit of us and our teams, but also our customers.
I'm passionate about the NHS because it's something that our country relies on, and I believe it could be offering a better service. The NHS need help to get these projects up and running. We do have that true expertise to become the healthcare specialists that we are.